All right, so we're going to start talking about shoulder external rotation, but also incorporate a bit of scapular stability while we're doing this exercise. It's a pretty common exercise. However, we want to make sure that we're doing it right technically, leading from the shoulder blades instead of just in your glenohumeral joint. So what Lexi is going to do is she's going to keep her arms in relative neutral, her elbows at her sides, and what she's going to do is she's going to just rotate out to the side. Now, our goal here really is to just isolate the movement in the shoulder. So you want to make sure that your chest isn't popping forward, because then you're going to be compensating a little bit with your low back. You want to maintain that neutral spine along with the diaphragmatic breathing techniques that we talked about earlier in an earlier video. So what Lexi is thinking about is, once more, keeping arms at your side and rotating out just through the shoulder here. The main part of this that we want to talk about is, Lexi, let me have you turn around, how to incorporate your shoulder blades and how to think about what we call your interscapular muscles. So your rhomboids, your mid-trap, and a bit of low trap as well. So even before Lexi begins to initiate, what she's going to start thinking about is bringing her shoulder blades together and down, almost like you're placing your shoulder blades in your back pockets. So from here, together and down. Good. While she's holding that together and down, now she begins to rotate out. There we go. And back in. Good. Very nice. And one more time for me. So shoulders together and down. Now holding your shoulder blades in this position, now you let your arm rotate back and then let your shoulder blades follow. What happens sometimes is if I were to have Lexi pull on back here, if she lets this go before she lets her arms go, what happens is all the smaller muscles in your glenohumeral joint then take on the stress of having to negotiate that rotational force in the arm. So one more time, shoulder blades together and down first, and then rotating out, arm rotating in, then let your shoulder blades go. One more time, shoulder blades first, together and down, rotating out. Good. And then keeping that there, rotating in, and then letting that go. So from here, you can see that she's maintaining that nice neutral spine. If we don't have enough abdominal control or stability here, what happens is we start to go into a bit of lordosis, so a bit of anterior pelvic tilt, and then that results in a whole slew of other different compensations. So one more time, you want to make sure shoulders together and down, and then rotating out. Good, nice. Feeling those rhomboids and mid-traps, holding in the middle, bringing your elbows in, or your hands in, and then releasing back.